Well, greetings again. I wanted to go over a double jaw surgery that we did the surgery on way before I realized that you could do these things orthodontically. And we've got these cases, about 9 or 10 cases that we've done without the surgery, and they are holding up. And I want people to look at, especially the one of the stewardess for Southwest Airlines. We did it 37 or 38 years ago, and it's still holding perfect. So let me show you one we did with a surgeon, one of the best surgeons in the country, worked on this young man, and we'll try to go through that and show you what we did. Now you look at him, he has a retruded lower jaw, and you need to bring it out, and then you had to reduce the vertical height of the face, and you had to widen this arch out, and when you look at it from the front, it looked like that. When you looked in here, it was a holy mess. And back when I started this case, I did not have any idea that you could possibly correct this. This one is probably so bad you couldn't do it without the surgery. So let me show you what we actually did. So he had me take out the second bar up here and the first bar down on the bottom here. And we took those teeth out for him. And then he diagnosed what we would do with the case. Now, we take these first bars out, and he's going to line that lower jaw up and upright, that look like that second molar back there. I had to pick it up. Now, this is 5 of 88, 1988. All right. We came around and we leveled all this up, and when we got through with that, he had me cut the arch wire right in here. I don't think that was cut there, but it was cut here, and we pulled them together. In other words, he sectioned the maxilla to do that and brought those together. And it worked. The surgical thing worked great. You can see that molar back on the back over there, how it lined it up. Now we ended up with the facial structure looking like this. Completely different. Now that's the lower arch. After we took out the bars down there, leveled it out, and here it is in 1990, after the surgery and everything was done. Went from that to that. And that, see how narrow that is? Now what he did, he sectioned the maxilla and put it back together. Let it grow back. There's where we ended up with the maxilla. This was the bottom jaw. Now we take those bars out right here. Move these back here. Like that. That's 8 of 90. So we took the wisdom teeth out, plus the bicuspids. It's 8/16/3 when we did that. holds all that together. Now, these are little things he screwed on the bow up above when he sectioned it. And Maxilla sectioned it up and put it back together with those things. He advanced the mandible back here and put screws in it. You see where the screws over on this side too. That shows you all the stuff that went through this case to do it. Now he's got that screwed in. He had apparently advanced the chin button to some extent too. Now there's where he moved the jaw together underneath the teeth. That's a good view of how the mandible was advanced. You cut down one side and you cut the other over here, I think. And then he cracked this, pulled that together, and then he put some screws in there to hold it in place. Now here's the guy after he finished this. That's the way he looked. Now he's got some screws in this and these little plates up above. Now this type of surgery today would be something in the neighborhood of $100,000 or more. I don't know exactly how much, but that's the way it ended up. And then they transferred and moved to Colorado, I believe. But that was the change in the person's face. So I wanted to show you what surgery did and how you could do it. And we were able to come in on many of these cases and do it orthodontically, and they look just as good. But I don't think I could have handled the case this bad like that. So thank you for watching, and this is what we did. I worked with this guy, the surgeon here is one of the best in the country that did this. So I thank you for watching, and you can still do the surgery, but we can learn how to do many of these double jaw surgeries with orthodontics. And I'll have to talk to him about that. So I'm going to hang up and say goodbye for the time being, and we'll come back next week with some other stuff. Thank you very much for watching, and I'm going to close out.